Hi, I'm Helen Shields, Professor of Medicine, Harvard Medical School, Associate Chief of the Division of Medical Communications, and Senior Physician in the Division of Gastroenterology, Hepatology, and Endoscopy. I'd like to tell you about the basics of performing and publishing medical education research. I came to this area late in my career. Actually, just 10 years ago, in 2007, I published my first medical education study in academic medicine. So I have a fairly fresh viewpoint of what it takes to do a medical education study and how much fun it is to do it. My objectives for the basics of performing and publishing medical education research are as follows. Number one, design an intervention to answer a question that you find interesting, fascinating, or problematic, and collect pre-intervention and post-intervention data on the outcomes. Recognize the need for institutional review board or IRB approval before the data is collected, and seek expert advice on both survey instruments and the methods to analyze your data. Establish authorship from the get-go and write up outcomes and submitting them for publication. How will you answer your question? Your fascinating, interesting, or problematic question will be helped by doing an intervention that will study your question before the intervention, ideally, and after the intervention. What are the relevant measurable outcomes? It can be as simple as, do the students prefer this curriculum to the one they had last year? Are the patients more engaged? Are the nurses feeling that their voices are being heard? Are the residents happy with attending rounds, walk rounds? Do they find them high yield? How will you obtain these data? You need to get permission to access the data, and the first access point is IRB approval from the medical school if you have medical students involved at all, and potentially if it's at a hospital that the medical students are working, then the hospital IRB also. If it's just hospital-based with no medical students, then a partner's IRB for any of the partners' hospitals is fine. You need to request permission to access the data, either for medical students at the medical school's assessment center or from the hospital record room to access outcomes for your intervention, or potentially a questionnaire that you request IRB approval of. You create this survey to study the population of patients, attendings, residents, nurses, or medical students that you're interested in. How do you collect the data? I would always ask for statistical consultation and consider creating a Qualtrics survey. Harvard University has a license that is free to all Harvard faculty fellows for use of a very simple Qualtrics survey tool. You can generally create your own survey. My caveat is, please ask a statistician whether your survey captures all the potential quantitative and qualitative data that you wish to have. What is considered a significant outcome? It's the same for medical education projects as it is for basic science research and clinical research. It's a p-value of less than or equal to 0.05 for quantitative data. For qualitative data, you should have data indicating a robust change in perception or performance from your survey instruments or other measures that you can tap into. How to avoid the failure of your innovation in medical education. My first major medical education project was almost a failure because I hadn't recognized and gauged correctly the resistance of the faculty who were about to carry out the intervention or innovation. So that led me to understand that you need to recognize and gauge that faculty, residents, fellows, and students' concerns about the intervention or innovation should be addressed from the start. Get buy-in ahead of time by involving these groups in focus groups, discussion groups, faculty development sessions, so that your intervention has a chance of succeeding with their help. What are the nuts and bolts of publication? First, determine authorship before everything else. Who is going to lead the study? Who is going to do the majority of work? Who is doing what? It's so important to have this established at the very first meeting of you and your colleagues, you and your fellows, you and your medical student. Who will be first author? In addition to doing a majority of the data collection, there may be other leadership roles which are important, and that must be taken into account. Identify all measurable outcomes. It becomes clear often as the study goes on that there are far more outcomes that you could tap into if you think about them and ask your assessment centers, your hospital, what else can you do to see if patients are more satisfied, students are more satisfied, residents are more satisfied with your intervention. Enlist the help of a statistician to create surveys that have Likert scales embedded in them so that you have quantitative data in addition to qualitative data of people saying, I like this better. Set a timetable for writing the manuscript and stick to it. Submit it for publication, recognizing that medical education research is a very competitive area currently. You may have to revise and resubmit to multiple journals until it's accepted, but it's well worth the effort. Where can you submit your work to? The roster is here, ranging from academic medicine, clinical teacher, through the JAMA education issue, which is considered a very prized issue, but also highly competitive, to specialty journals such as gastroenterology or emergency medicine, which have specific corners in them for educational articles each month. The AAMC MedEd portal is another place to submit curriculum innovations. You can report your data as a pilot study, meaning it has only a small group of people who've had a positive outcome, but it looks very promising. This is shown here, a pilot study of team-based learning on inpatient rounds by Dr. James Colbert, who was a resident at Brigham and Women's Hospital a few years ago, is now an assistant professor of medicine at Harvard. To this, which we published in 2015, a 6-year long faculty development program of 1 hour integrating cross-cultural care into a gastrointestinal pathophysiology tutorial, and showing that over those 6 years, it consistently benefited students, tutors, and the course as much more long-range, in-depth study. So my takeaways are, first, ask a question that you find fun, interesting, problematic, and you're passionate about. Why is something the way it is? Can it be better or different? Number 2, design an intervention to achieve a desired and measurable outcome. And 3, utilize statistical consultation for both the creation of surveys as well as the analysis of your data. 4, no data can be accessed without IRB approval, so go ahead and get it. Make sure you're CITI certified to be the principal investigator or co-investigator. And finally, write up and publish your results, having established authorship at the very first meeting of you and your group to start the study. The slide set and a takeaway are on the Brigham Educational Institute website. Thank you.